Welcome to this Step 2 clinical knowledge review on integrated case practice and diagnostic reasoning. This video is brought to you by Roadmap to Residency. Today we will break down the long, multi-system questions that span several organ systems at once, and we will give you a clear strategy to find the diagnosis and pick the next best step with confidence. The goal is not to reteach every disease. It is to show you how to read these cases, how to reason through them, and how to avoid the traps. Make sure you have your main review book and a question bank open alongside this video, because the strategy only works when you drill it on real questions. Here is what we will cover today. First, you will learn to recognize the multi-system question stem and find where the writers hide the diagnosis. Second, you will apply a step-by-step diagnostic reasoning ladder to cases that touch many organ systems. And third, you will master the management decision tree and the next best step format that these integrated cases love to test. This video assumes you already have some baseline content knowledge. We are here to sharpen the way you think under exam pressure. Our first strategy is learning to spot the multi-system case. When a stem touches several organ systems at once, the writers almost always want one diagnosis that explains everything you see. Your instinct may be to treat each finding on its own, but resist that. Instead, ask which single condition could link the skin finding, the joint pain, and the laboratory value together. At the same time, watch for the distractor. Long stems bury one or two findings that point you toward the wrong system. Learn to separate the detail that is incidental from the detail that is central. The central clue is usually the most specific, the rarest, or the hardest to explain any other way. Strategy 2 is building a diagnostic reasoning ladder. Start at the bottom rung. Group all of the findings into a single problem list, name the one syndrome that ties them together, and commit to a leading diagnosis before you ever look at the answer choices. Predicting the answer first is powerful because it protects you from being pulled toward a tempting but wrong option. Once you have your diagnosis, climb to the next rung and ask what the question is truly testing. Is it asking for the most likely diagnosis, the best test to confirm it, or the first treatment? Matching your answer to the exact question being asked is where most points are won and lost. Now let us look at high-yield integrated stems that show up again and again. First, the young woman with fatigue, a facial rash that worsens in sunlight, joint pain, and protein in the urine. When skin, joints, and kidneys appear together, think of a single systemic autoimmune disease, not three separate problems. Second, the patient who is breathless lying flat, has swelling in both legs, and has crackles at the lung bases. Heart, lungs, and the exam point together toward heart failure. Third, the older patient with new confusion, a low sodium level, and a recent medication change. Brain findings plus an electrolyte abnormality should send you hunting for a metabolic cause before you reach for imaging. Learn these patterns and you will recognize them instantly on test day. Let us work through our first practice question. A young woman comes in with several weeks of fatigue, aching in both wrists and knees, and a rash across her cheeks and nose that flares after she spends time outdoors. Her urine shows protein and red cell casts, and her blood count shows mild anemia and a low platelet count. The question asks for the single most likely underlying diagnosis. Take a moment to group these findings and decide what one condition could explain all of them before we walk through the answer. Let us break this down step by step. Step 1, group the findings. We have skin, joints, kidneys, and blood cells all involved at the same time in a young woman with a rash made worse by sunlight. Step 2, name the unifier. The rule for integrated cases is to pick the one diagnosis that explains every system, and systemic lupus erythematosus ties the rash, the joints, the kidney inflammation, and the low blood counts together. Step 3, eliminate the wrong answers. An isolated kidney disorder ignores the rash and the joints. A primary blood cell cancer does not explain the sun-sensitive rash or the kidney casts. A skin-only drug reaction cannot account for the kidney and blood findings. The correct answer is B, systemic lupus erythematosus, because it is the only choice that ties every system together. Here is our second practice question, and this one is about choosing the next best step. An older man with long-standing high blood pressure reports several months of breathlessness when he lies flat, along with swelling in both legs. On exam, he has crackles at both lung bases, raised pressure in the neck veins, and an extra heart sound. A chest film shows a large heart and fluid in the lungs. The question asks for the most appropriate next step in his evaluation. Notice that it asks for the next step, not the final treatment. Think about which option confirms the diagnosis before we walk through it. Let us work through the answer. First, read the question carefully. Breathlessness when lying flat, leg swelling, distended neck veins, lung crackles, and an enlarged heart all point clearly to heart failure. The question asks for the next best step, not the final treatment, so we want the test that confirms the diagnosis and guides what we do next. Now, why does the echocardiogram win? Because it shows how well the heart squeezes and fills, and that single piece of information decides the whole treatment path. Reassurance ignores obvious disease. Transplant is far too aggressive a leap this early. Home oxygen treats a symptom without finding the cause. The correct answer is B. Order a transthoracic echocardiogram. Let us talk about how to work a management decision tree, because the next best step questions live and die on sequence. The first principle is to stabilize before you diagnose. If the patient is unstable, the next best step is almost always to support breathing and circulation before ordering any test. If the stem mentions dangerously low blood pressure, a blocked airway, or serious bleeding, the tree starts with stabilization, not with the confirming study. The second principle is to choose tests and treatment in the right order. For a stable patient, take the history, do the least invasive confirming test first, and then treat. Watch closely for answer choices that skip a rung, such as jumping to surgery before a basic test or starting treatment before the diagnosis is even confirmed. Here is our third practice question. An older adult is brought in with 2 days of new confusion and drowsiness. A diuretic was recently increased to treat leg swelling. The vital signs are stable, and there is no focal weakness or vision change. Blood work shows a markedly low sodium level. The question asks for the most appropriate next step in management. Think about how the brain finding and the electrolyte finding fit together, and where each option falls on the decision tree before we walk through it. Let us break down this answer. Spot the pattern first. New confusion together with a markedly low sodium level right after a diuretic was increased points us straight at a metabolic cause. When the brain finding and the electrolyte finding fit together this neatly, treat the electrolyte problem before reaching for imaging or antibiotics. Now the key distinction. Brain imaging first ignores the obvious sodium clue and wastes a step on the tree. An antibiotic treats an infection that is not even described in the stem. A sedative only treats a symptom and can actually worsen the confusion. The correct answer is B. Correct the low sodium carefully and reassess. Here is a critical test-taking pearl for integrated cases: how to rank management options when more than one choice looks correct. When several answers are all reasonable, the question is really asking which one comes first. Rank them in this order. Protect life first, then relieve immediate danger, then confirm the diagnosis, then treat the underlying cause, and only then arrange follow-up. The most correct option is the one that is both safe and earliest on that list. Integrated cases often place 2 correct-sounding steps in the same question, just to see whether you know the sequence. Always read the final sentence of the stem, because it tells you whether the question wants the immediate action or the eventual plan. Answer the exact question being asked, not the one you expected to see. That wraps up our review of integrated case practice and diagnostic reasoning for Step 2 clinical knowledge. Remember the core moves, group the findings, name the one diagnosis that unifies them, and then climb the decision tree in order from stabilizing the patient, to confirming the diagnosis, to treating the cause. Keep working integrated cases in your question bank every day, and read the explanations even when you get the question right. Visit www.roadmap2residency.com for expert tutors and residency advisors who can build you a personalized study plan. If you found this helpful, please like and subscribe so you do not miss our next board review session. Good luck on your exam, and we will see you in the next video.